Welcome to Fit, Faith, and Purpose 360 Total Woman podcast with Deirdre, aka D Banks. Listen, here on this podcast, we're going to be talking about living a fit, faith, purposeful life for women over 40, the over 40 body changes, finding balance, and healing in your mind, body, soul, and spirit, what your purpose is, and my favorite, discussing the Word of God and how to apply the Word of God to your life. So sit back and enjoy the ride. Again, I'm your girl Deirdre, aka D Banks. Welcome to Fit, Faith, and Purpose 360 Total Woman. I'm your girl Deirdre. Welcome. I'm excited about this episode. Before we jump into this episode, listen, if you have not liked, subscribed, or shared this podcast, what are you doing? We need you to come in and support us, and so that we can build this community of women who are ready to live a fit, faith, and purposeful life on purpose and with intention. So I'm excited about this episode today because I have this amazing woman. As you guys know, back in May, I had a lumbar microdiscectomy. And after that, I had to go through the healing process. So I want to talk with my therapist who helped me to get, I'm going to let her tell you if I'm back to 100% or not. I feel I am, but I want her to share in that. So without further ado, I want to bring to the stage my therapist, my physical therapist, Jordana. How are you? Here we go. Let's see. Here you go.
Hello. Hi.
Hey, so introduce yourself to everyone. Tell them something about yourself, and
Okay.
we'll go from there.
Okay. Well, I'm Jordana. I am a clinic manager and physical therapist at Physical Therapy Institute in Sherwood. Um, I graduated PT school in 2018, so I've been working like 6 years now. I started kind of in the outpatient world, which is what I'm doing now. Did some work with Baptist for a little bit, and then came over to PCI last year. So I'm very happy where I'm at.
Awesome. Okay,
Yeah.
so we got the icebreaker.
Okay.
What song do you listen to in the morning that helps you get ready, get you pumped, get your day started? Share that song with us.
You gave me like 5 minutes to think about this. I needed like 30 minutes. The
You
first,
did 30 minutes.
the
Nah,
first
you don't get
song,
mine.
the first song that came to my mind, it was on our little radio station that we played at the clinic the other day.
Mhm.
Eye of the Tiger, Rocky movies. Let's play that song. I'll get going in the morning.
That's what you know what? I haven't heard that song in a long time. You're right.
Yeah,
It is a song that gets you motivated, get your day
yeah.
started. And yeah, I like
It's
that.
gonna
Okay.
get me
Eye of the
going
Tiger. All righty. Okay,
for sure.
so I want to jump in. I have a few questions and we're just
Okay,
gonna let it flow and see where we go from here. Um,
awesome.
I don't think a lot of people understand how important physical therapy is after having surgery. So, what is the role of the patient and the physical therapist after having surgery?
Yeah. Well, I think first and foremost, the job of the patient is to get into PT. Um, and that starts even, prior to surgery. If you know that you're going in to have a surgery, talk to your surgeon and be open about, hey, am I going to need physical therapy after this? And if they say no, or like, you can or cannot, advocate for yourself because 9 times out of 10, after a surgery, any kind of orthopedic surgery, physical therapy is needed, not even just like a cherry on top. Like it is needed for you to get back to being functional and pain free and where you want to be prior to whatever was hurting you. So that, I mean, step number one is that as a patient to advocate for yourself to your surgeon or your surgical team, whatever kind of surgery you're going into. Secondly is to get into PT. I have several cases where somebody has a surgery and then they have to wait the 4 to 6 weeks or whatever before they can get into PT, and then they don't want to come and they don't come and don't do it. And those people suffer, and I think I see a lot of those patients 6 months 8 months later who didn't come to PT initially, and they're in almost a worse spot than they were prior to the surgery when they could have fixed that coming to PT 6 weeks after their surgery or whenever they were allowed to come to PT. So I think that's step number two for the patient is to show up and to be there. As far as PT's role when you first come in, my number one thing, especially post-surgical patients, I want to make you feel comfortable. I want to educate you. If your surgeon did a good job educating you on your surgery, that's great. I want to talk about, what to expect through therapy, what your goals are. I think that's a big thing for me, is to figure out what my patient's goals are and to see like how realistically a timeline would be to get to those goals. So I think initially that's my job: make you feel comfortable, talk about your goals, and educate you on timeline and those sorts of things. Go ahead.
How important is it to choose the right physical therapist? Because oftentimes, what I've heard, so I work for a neurosurgeon as on the other side, so I know the patient side, and then I know the side as of working with a neurosurgeon. And oftentimes, what I've heard is what they felt about the physical therapist they may have chosen. So, how do you choose the right physical therapist?
Yeah, I think that is super important. I've heard not so great stories about people going to PT and just not feeling heard or listened to. And I think, just like choosing any healthcare provider, you want to go where you're listened to and where you're heard. And I think that is my job as a PT, your first visit. Like if you come in and you feel like I'm just rushing through the things that I need to rush through, that's not going to make you feel confident in what I'm doing.
Right.
Even if I'm the smartest PT in the world, like you're not going to feel comfortable with that. So I think that's very important, because that's going to determine, number one, how comfortable and confident you are in my ability as a therapist, but also it's going to determine if you come back. You know what I mean? Like
Right.
you're not going to want to come back if you don't feel comfortable with the vibe of the PT in the clinic. And so I think that's very important. I mean, just like I said, choosing any healthcare professional, I think that you need to be comfortable with them, because PT is a very intimate thing. Like, Dee Dee, I'm working on people's backs, I'm rubbing your butt. Like, it's a very intimate thing.
Right, right.
And it's the truth. That is the truth. And if
Yeah.
you're not like comfortable with telling me things or talking to me about certain things, or like if I'm doing something that hurts or doesn't feel right, like you have to be comfortable enough with me to tell me, and I have to listen to you. And if right off the bat that's not going to be the PT that you're seeing initially, I think it's worth having a conversation with them first of all and telling them that. And then if that's not like received well, finding somebody else.
Right. Okay, you are right about that. So let's take them through my journey when I started with you, approximately, I think about 2.5 months ago. What it looks like from that initial visit, and then what it is for me to show up to make sure that I also participated. And I did the work at home to make sure
Right.
that I'm going through the
Right.
healing process too. So
Right.
can you walk them through like what our initial visit is, and
Yeah.
then like what that's been through the progress
Right.
to where we are now?
So with you specifically, you came, what, 6 weeks after your surgery, Dee Dee?
Actually about 4 weeks after.
4 weeks.
Yeah. Mm-hmm.
So you started with me 4 weeks. And initially you had a lot of precautions, like surgical precautions. You couldn't bend, lift, twist, couldn't pick up anything, over 10 pounds, I think at that point, maybe even 5.
Yeah, 10 pounds at
Um,
that point.
so initially you come in, I greet you, introduce myself. We usually go to a private room, and half of the first session is really just talking.
Mhm.
I do a chart review before you come in, so I know typically what your surgical procedure is that you had, what precautions you have if your doctor sent that over to me. Sometimes they don't, so I'll either call the office or rely on the patient for those details. But a lot of it's just talking, especially the first visit. Like I said earlier, kind of figuring out what your goals are, and where you're at pain wise, I think is a big thing, because depending on the surgery and depending on the patient, you could come in 4 weeks post-op and be in a lot of pain still. You weren't really, you were feeling pretty good at that point, if I
Yeah.
remember correctly, Dee Dee.
Yeah.
So it was almost like educating you on things that we could do at that point versus things that we still didn't need to do at that point because of your surgical precautions.
Mhm.
Um, I do a subjective exam, so talking to you, then an objective exam. So I looked at kind of your range of motion of your spine, which was limited at that point because you had precautions. A lot of palpation to the muscles around your spine, which yours were very tense and tight at that point.
Yes, they were.
You remember, right? Which is
Yeah.
normal after a spinal surgery. Like, that's not uncommon. Check muscular strength, see if you have any like radicular numbness, tingling down your legs, those sorts of things I look at. And then after that, kind of talking me through what to expect during PT, what exercises we're going to do right now, what to avoid right now. And then we get in the gym and do some work. And then at the end of every first session, I give my patients a home exercise program. And like you said earlier, like that is another job of the patient to make sure that you're doing that as I prescribe. And also relaying back to me, like, if you have issues with certain things at home that I've given you, so we can modify and adjust that as we go.
How, because I know you challenged me, so we're towards the end process now. And so you have challenged me in ways that I didn't think my body could perform.
Good.
I think like the leg press, we started out at 40?
Yeah, real light.
Now I'm at 90. And I was like, yeah, are you crazy? I can't do nothing. Like, what are you thinking? But you are very in tune enough to know what limits we can push ourselves to. What helps you to gauge that? And when a patient is afraid and be like, I'm not ready to do that yet. What gives you that?
Yeah, I think, honestly, number one, like I said earlier, is just listening to the patient. Like, if they're scared of something, or maybe not scared, apprehensive about something, and I'm like, no, do it, they do it and it hurts them, why would they like trust me to make those decisions? You know what I mean? So first and foremost, I'm going to listen to the patient if they're apprehensive about something, but I'm pretty sure that, it's not going to hurt anything. They're going to be fine. Have them do a couple reps and say, hey, how does that feel? Or stand by them while they're doing those reps and make sure every rep is done correctly with the proper form, that they're not hurting, those sorts of things. And honestly, just experience has kind of helped me like learn, what things are safer to do, what things to avoid with certain issues. So I think like those two things together, really listening to the patient and, modifying things. There are a million different exercises that can accomplish the same goal. So if I have a patient, like for you, Dee Dee, you don't like the hip machine.
Nope.
I get that. No one likes the hip machine. But you know what? We can do those lateral walks, and it does activate the same muscles. And we can do the push-outs that you also don't like very much, but you're still activating the muscles that you need to activate without doing, one exercise that you hate doing or that you're apprehensive about. And we can still get the same results, just modifying a little bit.
What are the different modalities? Not only, you said get in the gym and we get to work, but what other modalities that you also offer? Because I know what I like.
Yeah.
But what are the ones that you offer and also do?
So I think PTI in general does a lot more like soft tissue work, like manual therapy, manual therapy basically just means me getting my hands on you. And I think PTI does a really good job of being very manual forward physical therapy. And I'm not going to say a lot of, some outpatient clinics don't take that time, because that takes 15 to 20 minutes of my time with you one-on-one. But I feel like, and PTI feels like that's a very important part of the process. So, I do a lot of soft tissue mobilizations, massage, those sorts of things to kind of loosen up the tissue, bring good blood flow to the area. We do joint mobilizations, which I've done on you, Dee Dee, to help get the spine moving a little bit better. We also do cupping, which is little suction cups that we stick on the muscles, brings good blood flow to the area and helps reduce like muscle tension and tightness. Yeah, right. We do dry needling, which I've done. Well, we did that pretty early on.
Yeah, we did. We did dry needling pretty early on. Yeah.
But that is just another modality to use to help loosen up muscle tightness, bring good blood flow and hormones to the muscles to help with the healing process, helps reduce inflammation, stuff like that. We have plenty of other modalities that we use sometimes. We have electrical stimulation, TENS unit. We have something called a Normatec, which is really good to help with to like reduce swelling in the extremities. You haven't even seen that yet, but say somebody comes in post knee surgery, put this compression sleeve on them, and it helps kind of reduce some of the swelling around the knee. But those are the main ones that I use. There's plenty more that are used elsewhere, but those are the main modalities that I use.
So, where are you guys located, and how can individuals get in touch with you to get started? Like, what give them the
Yeah.
all.
So PTI in general has 5 locations. We're in Sherwood, which is where I'm at. There's a Benton location, Maumelle, a location in the Heights, and then a location in West Little Rock. My clinic in Sherwood is 7507 Warden Road. It's right by Kohl's. And then the best way to get a hold of me specifically is my email address, and I can give that to you if you want me to, Dee Dee.
Sure, yeah.
Yeah, it's jandrews@ptipt.com. And then our office phone number is 501-301-4530.
Definitely, I want to say, just from my own personal experience, you guys have been very amazing at how well you have handled me, to the point I refer everybody. I talk about you all the time
Yeah.
because I think not only is, I mean, PTI amazing, but you have a gift to me, because you do pay attention and you do know when to push and you know when to pull back, and then you do listen. Like, literally, I don't know what you guys have experienced out there with physical therapists, but she actually does listen. I'm not blowing smoke. She really does listen, and she really does care. Like I said, I've referred a lot of patients that have been through a lot and have experienced a lot, and you have been very gentle with them and getting them back doing more than what they have ever done, going other places. What things can you tell women going forward? Because this is what this podcast is all about,
Right.
women
Yeah.
over 40. So, what tips can you give them, pre surgery, post surgery? Like, what tips can you give them that they can get started today and then get on the road to finding a physical therapist to go along the way?
Yeah. I think, like, just in general for women, I think we don't do a very good job of advocating for ourselves. So that's always my number one like tip is, I don't care if, who your healthcare provider is. If they're the smartest guy in the world and you have a question, ask it. Like, always advocate for yourself and ask the questions that you want to ask, and don't let especially healthcare providers rush you through a process, especially if you're unsure about something. Like, always ask questions, always advocate for yourself. That's the main thing that I tell my patients, even to me. Like, if I have a patient that's unsure of why they're doing an exercise, ask me. Like, I don't mind to answer those questions, and your other healthcare providers shouldn't either. That's our job. That's part of our job, is educating our patients. So always like be mindful of that, and don't be afraid to ask questions. As far as wondering if you need PT or if PT is going to help, contact me. Like, email me, call the clinic. I don't mind one bit to talk you through something. Even if you don't want to come in like for an initial visit, I don't mind to talk people through things just to see if PT is going to be a good fit. And I'm also not afraid to say, hey, I don't feel comfortable looking at that before your doctor looks at that first. I'm not going to tell you to come see me if I'm unsure about something. I'll definitely like refer back to your physician for something like that. But yeah, I think reach out to me. I'd love to help in any way I can.
I'm excited. I'm excited. I think this is going to be great. You cannot go wrong with PTI. I have one last question. When you initially start physical therapy post-op, I think a lot of people are concerned about how many times should they come initially, and then how do you taper off?
Yeah. So I sometimes the surgeon has a certain protocol that they want to follow. So I'm going to say that initially. Like, if your surgeon has a protocol that they want you to follow, then we're going to follow that protocol from your surgeon. But typically, if they don't give any guidelines for me, or if they kind of say let it be up to the PT, I usually try to start out with 3 times a week, post surgical. get you in 3 times a week. You do your homework, especially on the days that you don't come. You're going to see a lot of progress quickly. And then once we start seeing good progress, we taper down to a couple times a week as we progress things. See more progress, taper down to 1 time a week. And then, when it comes close to discharge, it's a conversation of, hey, have you met your goals? Hey, are you pain free? Are you able to do all the things that you want to do? And then when you get to that point, it's a conversation of, are you going to continue doing your exercises at home without me there to help you? And if yes, great, let's discharge. If not, let's come once every other week, or, however your schedule works. But the main thing is getting you to a point where you're pain-free and functional, and you feel confident in doing your exercises at home. And once you get to that point, then I'm ready to let you go.
That sounds good. Yeah, I'm not ready to be let go.
You can come forever for all I care.
I'm not ready to be let go yet. Like, I am spoiled. Like, you guys are amazing. I mean, seriously,
Well, thank you.
PTI has been a blessing to me. And blessing to everybody. I've heard nothing but great things, even from the people I've referred, and I will never stop talking about you guys, because I would not be where I'm at right now with the healing process and moving. And I know right now we're working on range of motion, so I can really get to feeling comfortable and moving around different ways. I would not be here if it wasn't for you. So I definitely want to give you your roses and say thank you.
I appreciate that. Thank you so much.
Absolutely. Well, we're to the end of this podcast. Is there anything else you want to let everyone know that we may have missed or didn't think about?
I don't think so. I mean, like I said, I'm an open book. If anybody has questions for me, please reach out to me via email or call the office, and I'll get back to you when I can. I'm not, of course, I want clients to come into the clinic, but I'm also a healthcare provider at heart, and I would love to help, anybody with anything that they have. So please feel free to reach out to me about anything. I'm here for you.
Awesome. So I'm going to put her information, PTI's information, in the description on both the YouTube, because it will be on YouTube as well as all of the podcast platforms as well. So that way you can get in contact with Jordana, get started with PTI. And you'll be hooked as much as I'm hooked as well. So I want to sign off the way I always sign off with all the podcasts. Listen, I love you. God loves you. And really, there's nothing you can do about it. Bye for now.